Welcome to HMS, let the power flow. Feel the rhythm in your veins. Every rapid nitro flame.
Okay, so our last part of our management and prevention of sports injuries section is looking at the return to play policies and procedures, okay? So imagine you've got your athletes, they've been injured already, you've gone through the rehabilitation process, now they're ready to return to play, but there are actually some policies and procedures and guidelines that dictate whether the athlete can actually take the field, right? So this isn't about training now, this is about engaging in competition. So the overall definition was sort of like the return to play policies and procedures are the decisions and protocols that dictate when an injured athlete can resume competition or competitive play. For example, if an athlete receives surgery, such as knee reconstruction, then the surgeon must sign off before the athlete can return to play. Obviously, there's going to be lots of other things that would have to be signed off before the athlete can return to play as well. You can't just get surgery and then get ticked off because you've got to test strength, fitness, etc. But we'll go through that in a minute. But definitely the surgeon has a role here to play, as do all the people involved in the rehabilitation process. So there's a few different sections that we're going to go through here. So our first section is looking at policies and procedures. So policies and procedures are actual documents, okay? They're legally binding and there's no exception, okay? It's written down in words and you can't budge from the policy and procedure. And sometimes it's unfair, but it is to keep the overall level of players safe. So as an example, national sporting bodies such as the NRL have formal policies related to certain injuries. And the example I gave you here is concussion, okay? If an NRL player experiences concussion, depending on the grade of it, they must have 14 or 21 days minimum rest and recuperation before they take the field again. No exceptions, all right? So if you're an NRL player, you're diagnosed with concussion, it doesn't matter what happens over the next 24 hours or whatever, you must wait a minimum of 14 days, okay? Because it's written in policy. It's like law for sport. Our second one, we've got sport-specific functional tests. Okay, so these aren't law, but a lot of clubs and athletes and associations will adhere to these testing standards to make sure their athletes are safe. So certain sports and clubs enforce a demonstration of sport-specific skills before they can return to play. So for example, a netballer with a rolled ankle must be able to demonstrate a single leg landing to prove stability at the joint, all right? So imagine you've rolled your ankle, obviously you've overstretched some ligaments or something going on there, and it doesn't matter how good your strength tests are and your speed and your agility and stuff, they may say that we want you to be able to demonstrate single leg landing. So jumping down from a box or doing a single leg hop and landing without rolling the ankle to demonstrate stability. And then they tick them off and say, yep, that's good. All right, so our third one we're looking at here is psychological readiness. And I did touch on this in the last section, looking at the rehabilitation procedure. So psychological readiness, we're assessing the athlete's confidence and mental readiness to return to play, all right? And I probably should have wrote that there. That's obviously going to be done by a psychologist. You could do questionnaires, etc. Right. So athletes who are not mentally ready are more likely to be re-injured as they move unnaturally to shield the previous injury, okay? So for example, an NRL player returning from shoulder surgery, let's say they got their left shoulder operated on, tries to tackle more with the opposing side. So now I'm returning to play. I just had surgery on this, but it feels good, but I'm not quite mentally there yet. So I'm gonna put more effort in with this shoulder today. And then they fracture this shoulder that very game because instead of bearing the load evenly across their body to minimize the damage to their joints, they take the brunt of it in one shoulder only, and now they're back out for 24 to 36 weeks on a second shoulder reconstruction, all right? Because they weren't mentally ready. Physically they were fine, but they didn't believe in themselves, they didn't have the confidence that they were ready to return, and now they're re-injured again, all right? So psychological readiness is just as important as being physically cleared as well. And then finally is responsibility. So whose responsibility is it to actually say you are ready to go, okay? So if you look at the case here, if an athlete was seeing a sports psychologist returning from rehabilitation, who should sign off to say they're mentally ready? Probably the sports psychologist. Because if you're being an honest athlete and this player told the psychologist, I'm just not 100% confident, the psychologist isn't going to sign off and say, nope, you're good. They're going to say, no, I believe you, because the health and welfare of the players is way more important than anything else for the medical professionals, okay? Same as if it's a physical injury, who has to sign off? The surgeon, the physio, the whoever it is that you've been seeing, okay? It's not up to you. It's not up to the coach, okay? You need to listen to these people who have spent many, many years studying and training and have lots of experience. They will know when you're good to go. And they will believe you. If you say you're not ready to go, that's gospel. So final return to play clearance needs to be given by medical authorities, not just coaches or players themselves, right? And you got to remember, like, players are under a lot of pressure all the time to perform, okay? Because if they're not playing, they're not earning money, and then their family might pressure them, and then their teammates might pressure them because their team's obviously losing now because they were the best player. So there's lots of pressure here, but you need to listen to the medical authorities. And when they say you're good to go, that's when you're good to go, okay? Happy days. So for example, and I was trying to think of an example here, but I remember seeing a video on this and it was gross. You look it up on YouTube if you want, but anyway. A kickboxer who was told to rest for 12 weeks, okay? So complaining about pain in their lower leg. So rest for 12 weeks. They return to play at the 4-week mark because they feel better, okay? The pain in their lower leg has gone away, all right? And they're like, oh no, I feel pretty good. So then they go out and they get themselves into a match and, well, lo and behold, they fracture their tibia and fibia, okay? And they never compete again. So they went back early when their medical people had told them to not return yet. And now they've lost their source of income because they probably didn't go to uni and all that kind of stuff because they've just been a kickboxer their whole life. And now, you know, bad things happen. So you've got to trust the people who are in the responsible section to guide you as to when you can return to play. So that's all I wanted to cover on the return to play policies and procedures. And that is the end of this whole section that's been the management and prevention of sports injuries. Thanks.